the musculoskeletal, and the respiratory systems.
You know, there's a lot more to learn.
There is, and that's one thing that you have to take into consideration is when you're out there in industry, you become specialty specific. And by that, you typically code the same types of procedures day in and day out. And if you think about it, the more that you're coding something, the more that you're going to retain about that particular subject. And that's why you specialize in that particular subject, right? This week when we look at cardiovascular, a lot of you are probably going to tell me, I don't ever want to code cardiovascular because it is very complex. But again, you know, most of the times those types of coding is where you're going to actually receive higher pay because it's more complex. So keep that in mind. A lot of the things that you need to know is not to memorize everything. It's ridiculous to have to memorize everything. Just know where to go to get the answers you need. If you have to take a look at some of the sites that we've explored in the discussion board, you know, if you have to take a look at some of those sites to understand a little bit more about the procedure that's being performed, you don't have to watch the gory video. You can look at the transcript. Just try to understand enough about that procedure to move forward. Medical dictionaries. How many of you are using your medical dictionaries? Yeah. And sometimes it's just to look up one word, isn't it? So it's those tools. This is what coders do. This is what they do out there in industry. If you were to, I actually have a former student that graduated from here. She completed the certificate program. She's going to be coming in within the next couple of weeks to talk to everybody. She's now working out in industry coding. And she was hired as a coder without her certification at that time. But she'd like to share with all of you what it's like to actually go from your studies and go out and what it's really like coding in the real world with what you're learning in the theory portion of it. The tools. I can tell you from my own experience in industry that every coder has a bookcase of all of those different tools that they prefer. And this is a skill. I mentioned that the first week of class. This is a skill. It's how you become familiar with using the tools that you have, how you feel comfortable. You could have 5 coders sitting in an area, and 5 coders would get to the same code using 5 different methods. Is one of them using the wrong method? Absolutely not. It's how you become familiar and utilize those tools to get to where you need to get, right?
I did have a question on that I was going to ask you last week, actually. And for some reason, I still run into it, is where I know we talked about the fact that we don't apply modifiers to the skin, you know, as far as left and right,
Right.
or whatever.
There is no laterality to the skin.
Right. However, there were a few examples in the homework where all of a sudden you came across one where they did put like a dash, T, whatever, for the toe, you know what I mean? Or, you know, so there were examples, I don't know if anyone remembers, where all of a sudden, you know, they threw in that, you know what I mean? So they kind of mixed it up a little bit, and I wasn't quite sure.
For integumentary procedure or musculoskeletal?
I thought it was
Because
the integumentary, where all of a sudden, remember that when we were talking about this with my son, and I said, so I'm getting.
let me know which, if you could let me know which
exercises.
exercises
I'll look for it, yeah.
that you're
because I was
referring,
like,
right.
Yeah, because I was like, wait a second now, you know, so now all of a sudden, you do it.
And I do know, as most of you probably have noticed, that I'm kind of retracting or backtracking and answering the discussion board posts. And I hope that all of you understand that it's not that I'm not eager to provide feedback, but I have to actually go in and verify every single code that each of you are assigning. So the tools and the time it takes for you to go in and you know, kind of assign a particular code, it's taken me the same time because I either have to watch part of the video, I'm using the same tools. I don't know these codes off the top of my head, but I have to take the time and go in and, you know, verify each one. So I'm pretty much, for this class, I'm pretty much caught up to date, but I just want to let you know that that's something that is very time consuming. If you have emailed me homework. I'm only here once a week, so printing I do here instead of doing it at home. So that poses a delay because then I have to go through hundreds and hundreds and hundreds of emails and remember who emailed me what and when, and you know, and it's, if you don't see something posted for a grade and you know that you've emailed the assignment to me, shoot me another message just so that I have a little heads up as to, you know, and some of you I know, you know, that have sent them to me. But if you have, just send me a reminder. That way it'll flag me to know to look for your name with the assignments. I've almost had the grade book completely up to date for this class, but I just want to, you know, remind everybody of that. That if you're not submitting through Blackboard, there's going to be a delay. All right.
I have a question on separate procedure. When you see something and it says separate procedure, does that mean that unless that's the only thing, we don't use that code, it should be included in what comes before it?
If it's performed as a separate procedure, that is when you would include it. If it's not kind of bundled into that main descriptor.
Okay. Is it always bundled into that main descriptor? Because sometimes you have the main descriptor, and then you have with this, and then it says with this special procedure. And
Right.
it's like, oh, okay, well, they did that, but because it's a special procedure, and I have to code something else, I won't take that. Is that how much, am I thinking of that properly?
It all depends on the code and which bodily system that you're referring to for me to appropriately answer that.
Okay.
One of the things that you need to understand is we're looking at half of the story when we're CPT coding. We're looking at half of the story. We're not looking at the whole story. We talked about that linkage between the procedural code and the diagnoses code. So the diagnoses code gives the other half of the story, the why. We're looking at the what, and sometimes it's hard to see the full picture when you're only looking at half of the story, right? So take into consideration that sometimes, although we're only seeing part of the story, that there is another part that exists. So, you know, you have to be somewhat astute in assigning the appropriate code, but go with your gut sometimes.
Okay.
That you're
Mind
selecting the
if
right
I
one.
give you like an example that we have in our homework
Yeah.
or something?
If you want to post it to that general questions,
Okay.
you know, that way everybody can kind of,
Yes.
does everyone check that from time to time? General questions? Okay. So that way everybody, you know, is on the same page with the answers.
I kind of found one of them when I was talking about it, maybe it's because it was, it involved the nails emulsion.
Yeah.
So even
Yeah.
though it was in the skin category, right?
Well, we've got the integumentary system and then the nails, which is an appendage of the skin.
Right.
So it's kind of, you know, and then we have the breasts in that section too, which have laterality.
Yeah.
So it's kind of, it depends on that subsection that you're referring to within that. But if it's a procedure that's performed on the skin, in the integumentary system, strictly, then that would be, you know, there would be no modifier at all attached to that because there is no laterality.
I was having a problem with the homework, just going through and trying to decide whether I'm coding a procedure or the actual condition, I guess, or diagnosis, because one of them was the emergency department record, and the other one was the operative report.
Okay.
And I thought because both said preceding procedure, that they were both looking for the same thing, and it ended up that they weren't. The first one was looking for procedure, which was splinting the leg. And then on the other one, on the operative report, when it said that, it was looking for fracture treatment, fibula closed, which that confused me as to how am I going to know the difference?
Well, because we're learning procedural coding, always look for the procedure. You know, if the authors wouldn't want, or the publishers wouldn't want to trip us up and say, you know, we're learning procedural coding, but here's a diagnosis question. So just kind of try to focus on the.
Well, in their operative report, they mentioned that the leg was splinted, but that's not what the answer was looking for.
Okay.
So how am I going to know when to choose that splint and when to go with it being, you know, fracture treatment? I mean, a fracture versus splinting?
Typically in that first statement where it has procedure performed, focus on that.
Focus on that, okay.
Focus on that, because that is, when we code, what do we code from? What do we code from? Do we code from what we think we should be coding from? Do we look at the whole operative note and code what we want to code? What do we code? We code what the physician documented was the procedure performed. That is our main focus, because we code what the physician documents. The physician is the one that certifies that patient's medical record. It's the physician. It's his responsibility. He's taking legal responsibility, stating that this is the procedure that's performed. If there's a question about that, or if you see that certain medications were prescribed or administered to the patient during their stay, or you see certain things in that record that kind of raise a flag because they're not mentioned, and I'm kind of speaking towards diagnosis coding right now, but if there's specific things in that operative note that could raise a red flag and say, wait a minute, this procedure has nothing to do with what was performed, yes, then we would query the physician, but we never code based on our own opinion. We look for that main procedure performed on the operative note or the discharge summary, whatever it may be. We look for what the physician states was done. And that's essentially, we're coding what he is certifying. It's his responsibility to get the documentation right, to a degree. You know, HIM will make sure that everything's done based on regulation, but it's the physician's duty in providing care to the patient to get those details documented correctly. So instead of looking at 4 or 5 pages of information, focus on those one-liners. That's why we're coding one-liners. That's what I like to call them, is one-liners, because they, you know, sometimes they give you enough information where you can go right to the coding manual and you can pull the correct code right out. But other times you do have to look through your documentation to get your measurements, to get age, to get different little bits of information that may be needed, but we always just focus on that one-liner. First off, that should be the first thing that you're looking up in the index. Okay. Does everyone know the difference between AAPC and a HEMA? Is everyone comfortable with that, knowing what that is? No? The AAPC is the American Academy of Professional Coders. There is a local chapter here in Manchester. The AAPC was formed in 1982, and they were formed to allow for certification. It's a national certifying body, but they allow certification for professionals who CPT code. So it's essentially outpatient coder certification. The AHIMA, which is the American Health Information Management Association, offers coding credentials as well. And they are, when you get a CCA or a CCS, those types of credentials state that you are both an acute care or inpatient and outpatient coder. You've received your education in both aspects. AHIMA was established in 1928. So it depends on what type of certification you're interested in receiving. One thing that I've noticed in job postings is that it all depends on the organization, what they're looking for. You may see a job posting for a coder and they're looking for CPC certification. Has anybody looked at any job postings just to? So they may be looking for a CPC, they may be looking for a CCA. It depends on which way you want to go. I mean, it's relatively up to you. They both have the certification exams, the national certifying exams, so it's up to you. If you feel that you like CPT coding a lot and you want to work for a physician's office, or you want to work outpatient, or if you want to work, you know, provide coding within the realm of what we're learning, then I would recommend AAPC certification. If you want to work for more of a well-rounded, you know, increase your marketability, then I would recommend one of the AHEMA credentials.
Can you do both?
You can. You can do both. The tests are around $300 each. So the tests, a lot of employers will pay for it for you, and that's why some students have actually been hired before obtaining the certification, and the organization is helping them out with that fee. You do have to, for both organizations, you have to have CEU credits. I know the AAPC charges a little bit more for their certifying exams than AHEMA. But you do have to maintain a certain number of CEUs each year. Each year I have my CCA. In hindsight, I should have gone for my CCS, but I gotta tell you, when I went to take my certification exam, I took both my RHIT and my CCA in the same day. I saved myself $100 by not going for the CCS, but I almost got in a car accident on my way home. My brain was fried. I mean, you go into these exams I had my coding exam in the morning, which it was 4.5 hours long. So I was able to take my coding manuals with me, but that's it. You know, that is all you're allowed to take with you.
Are
And
you
then I
allowed,
didn't.
I'm sorry, allowed to take the Tabers too, or no? Just the
No.
manuals? Okay, thank you.
So, that's why practice makes perfect. So although I'm not collecting those review questions and those workbook, you know, I'm not saying that you have to have 18 pages done per week. You have the answers, but don't stop or prevent yourself from doing them, because practice in this field makes perfect. Coders are learning something new every day. So just, you know, do those at your own pace. It's not required, but don't think, she's not collecting. No, I'm not going to bother doing it, because you're only hurting yourself. I mean, the more that you look at the coding assignments when you perform them first, and then you look at those answers, and you say, that's the rationale. That's why they came to this particular code. That's your learning. You are actually learning why certain codes are assigned for particular reasons. And that's, of course, how the learning process works, right? So just keep that in mind. But I did do both tests in the same day. Go ahead.
When you took your test, were you coding all over the place? I mean, did they?
It's multiple choice. And what I'm going to do is I'm actually, because every year now, as part of my certification, I have to complete a yearly review. It's a self-review. So every year I have to take a 20 question, I think it's 10 or 20 question, similar to the coding exam itself, but I have to take they're all multiple choice, to take this exam, and then each year I send it in, and it just continues. I have to report it with my CEUs, it's a requirement. But the tests are multiple choice. In advanced coding, you get study guides for both the AAPC and the AHEMA certifying exams. You get a study guide for both. One thing that I found really beneficial when I was studying is it comes with a CD. And you can take the CD. I'm not sure if the AAPC one comes with it, I know AHEMA does, but you can just continually just keep taking mock tests over and over and over. And it tells you